Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am so blessed today to be joined by the amazing Nicole Williams. Nicole comes to us from the Kidney Nutritional Institute. She works alongside Jessie Anna and Lindsay and a few of the others that we've had on the podcast. But what's really special about Nicole is that she is a certified life coach and she has a master's in public health, which means she has worked in the public health industry with helping patients advocate for themselves, educating them, preventative health. She really draws on a lot of knowledge here to be able to bring that in for when she's working with clients around their mindset and helping people just integrate the diagnosis of chronic disease, which is scary, but she's been out there in the real world. So it's not just meditate and you'll be good. She's got all these amazing practical tools that we wanted to talk about today. And the question from our community that we get asked all the time is, how do you advocate for yourself with your nephrologist, your renal dietitian, with your GP to get them on board with maybe doing some alternative therapies or getting some extra testing done? And we've brought Nicole on board today to answer those questions because this is something that she's worked with a lot. So Nicole, thank you firstly for joining us and giving up your time to be here. I really, really appreciate it.
Yes. Thank you so much for that introduction and for the invitation.
And is there anything I missed that you want to add? And maybe first let's start off by, why don't you tell our community really how you practice and what it is that you do for people diagnosed with chronic disease? Because it's scary when people are told you've got kidney disease and your only options are a dialysis or a kidney transplant. So
yes. Yes, absolutely. So as you mentioned, I serve the Kidney Nutrition Institute as a mindset coach, and so through that role, I see clients one-on-one, and I also support some community groups that we offer as well. But really, my main intention as a mindset coach in supporting clients is solely to understand what their needs are and to be that champion and that advocate for them. I want to make sure I'm working to strengthen their own support to heal themselves and understand that there's hope in this journey that they're going through. So we talk about a myriad of things. A lot of the most common things are around reducing stress, strategies to really help build relationships or support systems for themselves. Certainly the topic that we're touching on today is really a big topic as well. And also helping them uncover any patterns or thoughts or behaviors that tend to sabotage their efforts, rather than continuing to help support them. So you'd be surprised when you are faced with something like a chronic condition such as kidney disease, how all of a sudden these deep saboteurs that we have within ourselves, that everyone does really, kind of show up. I also work really hard to normalize their experience, how there are so many commonalities in the stories of their diagnosis, again, how they interact with their nephrologist or their primary care. So I'm also there to serve as that connector to help normalize their experience.
Yeah, really important. I think they're all amazing sort of things. So now that people have a context of that, let's dive in. So yeah, I've read the Kidney Disease Solution Program. I've listened to some of these podcasts and I think, yeah, okay, this makes logical sense to me. I want to try some natural therapies, but my nephrologist has said there's no proof in all of this. Those herbs might kill you or whatever it is. They've said, how do I have a conversation? How do I advocate for myself? Walk me through that. And there's so many multi-layered questions in that, but just start wherever you want to start and walk us through that, Nicole.
Absolutely. Yeah, it's such an important and really great question. So I would say starting with how you're approaching the relationship. So let's start there.
Okay.
And as any patient with a chronic condition, they're coming to their providers because they're the specialists, they're the experts. What I'd like to invite people to also think about is that it is a partnership relationship. So not just a one way, right? You're not just showing up and getting and being fed all the answers, but coming to the table with your own expectations, certainly having a list of questions, and we can talk about that in a second, but seeing this more as almost like a give and take. So I'm coming here setting up a partnership with you about my own health. And how can we work together to find common goals, for example, again, setting those very specific expectations on the roles, and thinking more about the nephrologist or the PCP, whomever that is, as part of a larger care team, and how that person fits into the larger care team. So I think that's the stage very differently from the beginning.
Yeah, and I think you're right. People go in thinking they sort of hand themselves over to the specialist, don't they? And expect the specialist to give them all the answers, because people feel powerless and they're in the shock of the diagnosis. So setting that example up from the beginning, or that relationship going, they're part of a bigger team, and that you're still in control is what I heard from what you said there.
Absolutely. Yeah.
So walk me through the next part of that, because I can see you've got some processes there.
Yeah. I think having questions is very important. I am a really big advocate for not just having questions, but asking those questions until you feel that the answers you're receiving are done in a way that you really understand and you have clarity, right? I think it's very easy for medical providers to speak in like the medical jargon, and health literacy is a totally separate topic, but that's something I've worked on in the past in my previous life. And so even as someone is maybe they're getting the diagnosis for the first time, and then they're being plummeted with all of this additional information. And it's a lot to process. So coming to the table with some really clear questions, and some of those questions might look like, what other treatment options are there? Really simple, right? Starting off really basic. And then if you know that nutrition might be a route you want to go, you can ask, what specific information can you share about nutrition or the benefits of nutrition as it relates to my condition? I would be very specific and also be upfront with communication. If you're seeking alternative therapies, share that with them. Here's what I'm looking at. I want to add this to my, again, my treatment plan and treatment options. Make sure that you are being transparent with your communication. What are the critical points that may require a change in treatment? So from your provider's perspective, right, understanding what their line of thinking is. Maybe it's when your GFR hits this certain level, we have to change our treatment plans. Or if you're at this level, then you're fine for a little while. So really having a gauge or barometer, if you will, to understanding what that looks like for you, your individual case. And then the other question is this a decision that needs to be made now? So
great question.
We're again given a lot of information, and I think it's important, particularly when you have a chronic condition, to give yourself space and time to think. When you're not sitting in a doctor's office where you may be nervous or feeling additional stress, maybe your blood pressure is raised. So there's so many things in the office space that can be a hindrance to our thinking and our inability to kind of get still and understand what we need for ourselves.
Yeah, it's a really great point, because I think what happens is people get a diagnosis, they go home and do a bit of research, they get scared from Google, they stop researching, and then they get shoved into the specialist office, but often unprepared. And I know from my own health journey, that's definitely something that happened to me. And it's just because I've got obviously medical training that I know how to advocate for myself, and I know all the alternatives. But if you don't have the medical jargon, which I do find, if you challenge health professionals, they tend to sometimes use that as a defensive mechanism. They start talking more technically to throw people off. I don't know if that's something you've come across. And I guess people trust that their doctors and their specialists have the best intentions for them going forward. And it's not that they don't, and I'd love you to speak to this, but they don't know you.
Right.
They've got a little box that they move maybe people through and things like that, but maybe they miss the nuance of you. And how do you build on that, or how do you actually create a relationship with your specialist, rather than feeling like you are a person that must do whatever they say, otherwise you're going to die. You know, that's definitely what one of my specialists said to me, is like, you'll be in a wheelchair in 5 years if you don't do what I say. And I was like, I don't think you get to tell me that. So talk more to that, about where you do have a specialist, because this is the comments again we get from the community, that they are very much not open to hearing about the patient's needs and journeys. And how do you advocate that? Can you, is there a point where you maybe need to move on? Like, talk to me about that.
Absolutely. So first, I would say, in terms of advocating for yourself, it's very important to get clear on your goals. So, and I see that also as you're thinking about your goals, also identifying your own values. So, and that may look like valuing your quality of life throughout this time over everything. So you want to make sure that you can maintain a certain lifestyle that you've had. Maybe you're an avid runner or something like that. It may look like finding ways to improve relationships with your family as you're building your support team. And maybe it looks like learning to love your body differently. So I would say, get really clear about what's really important to you, because that will then become your why or your driving force behind the questions and the kind of that desire to advocate for yourself, instead of, again, like we said at the beginning, kind of just showing up and kind of serving yourself, if you will, to the providers. The other thing is to always remember that we are worth it. So we are worth the fight. We are worth the extra work. We're worth the extra effort, the extra time. So that ties more into the mindset piece, and understanding that as you show up and you're maybe getting that pushback, there are times when patients may just kind of give up. Okay, whatever you say, you know, I'm going to go along with the plan. Again, giving yourself space to step back and remember that you are worth the extra effort that it may take that provider, that it may take a larger medical team, that may even take you to uncover a different specialty, if that's what you need. Another big part of advocacy, which I find is so important, is keeping your own records.
Very good point.
Yeah. You know, so keeping your own records looks like having copies of your most recent lab tests or information, right, from just your medical record itself. The other suggestion is around medication. That's a really big one, particularly if someone has a comorbid condition and they're taking different medications for different reasons. That would be important to keep track of. While you're visiting with a provider or having those appointments, request if you can voice record them. That way, you're, again, in that space, we're processing so much. And I would love to look up the statistic, but I doubt we're really retaining a lot of the information that we're given. And it doesn't mean that we're not intelligent individuals, but again, it's a lot we're handling and we're trying to navigate through emotionally, mentally. And so request something as simple as that, to voice record the session. And then when you get home and you have a moment, you can re-listen to it. You can take down your own notes. You can then think of additional questions that may come up when you're in a space to appropriately process what they're sharing. And the last thing I have here in my notes, which we've said already, is don't be afraid to ask those questions. And use that as a time to get that clarity and understanding you need to support yourself.
They're really good questions, and I think, and really good answers. And I think that's what I'm hearing is, and maybe the experience that a lot of people have, is they go in unprepared, and because they don't know what to ask. I mean, that's the other big thing, right, too. And so then when you get almost put into the system and move through, if you're not advocating for yourself or having your why or keeping all of that stuff, you're really at the mercy of someone else. So I guess what I'm saying is, what I'm hearing is, you're talking about really taking the power back and knowing that you're worth it and having you in control of your health journey rather than handing yourself over is the subliminal stuff that I'm hearing.
Exactly. And having that intention as you walk into the office, right? So as
You're your boss, you're hiring them kind of thing.
Yes, absolutely. Because the reality is you're there to set up a partnership, but there's also an exchange happening, right? So while we're not with insurance, that helps kind of shield some of the costs, but you are paying for this. You're paying for their time. And so I think it's important to remember that as well, is that if you were coming in there with a couple of $100s to pay for this visit, has the value of that visit met your needs? Right? We're not going to go into a store and spend a couple $100s on anything without really understanding the value that we're getting. And so stepping into that space, again, with your own intention, may not be perfect, and that's fine, but just having an idea for yourself of what you want to accomplish and how you want to, how you just want to guide that appointment along with your provider.
It's really flipping the switch on what people know as healthcare, because people go in and we talk about, the old school GPs, and I think this has improved over time with God complex. People just hand themselves over. What you're talking about is I'm paying for a service and I want to make sure that service matches my needs and expectations. And this is what I expect. This is what I need. And if I'm not getting that, why would I spend money on it? Because I am parting. It's an energy exchange, and it's a partnership, right? Versus you telling me what to do. And I think, I don't know where this came in to the doctor-patient relationship, but it's never really been set up that way ever, has it?
It has not. It really hasn't. And I've personally have changed providers twice because I wasn't pleased with how I was treated. And I knew that, my care for myself was really important. And I found that really empowering for myself. Empowering in a sense that understanding that, I play a role in this too, right? Taking back some of that control, but also kind of flipping that switch in the mindset space of understanding that I can decide. I can decide too. I can decide to change providers. I can decide to ask additional questions, share my opinion that I wasn't happy with this visit, or so.
Very empowering. So walk me through, when do you know to cut a provider free? What are the things that you look for? And then what is the conversation, or do you not even have a conversation, you just book somewhere else? What is the conversation that you have around that? How would you, someone going, well, I'm not getting my needs met, how do I address this? Maybe they've been with them for a really long time and they're just beginning to wake up to sort of this stuff now. So walk us through that, how that looks and how you would deal with that.
Yeah. I think, so first thinking about the messages that you might be getting from your provider. So at some point, if you're looking to end that relationship, you probably are also, there might be some messages you're getting from them that are not ones that are more empowering. So I think, as a mindset coach, as I thought about this, the first thing that came to mind is that to understand that you are valued, and that if a provider is like you said earlier, the provider said that you would be in a wheelchair. Sometimes they send out these doomsday messages. And so first thing is try not to internalize that as it meaning that you're not valued, is what I'm trying to say there. And so there's a few things I would encourage someone to think about first, and that is thinking or looking at other patient resources that are available for you. So that may look like filing a grievance report, speaking with a manager if there's a point that you really feel uncomfortable. Arming yourself with information. So arming yourself with science-backed information, connecting with other groups, such as K&I, for example, if it's kidney disease, that can provide a more holistic look and holistic approach to your health. Using another trusted provider as an advocate for you. So do you have a PCP that you really trust? or another specialist who you can confide in, share information with, and get their thoughts, or even request that they reach out to the nephrologist or whomever on your behalf to kind of maybe smooth things over or help understand what your mutual goals are. And then finally, I would say if you're at a point where you do want to sever ties, make sure that it is because you're not getting that value from that provider. And the other part of this, particularly within the US healthcare system, is sometimes someone doesn't always have the means to change providers. So it could be due to their insurance limitations, or maybe availability of that specialist that they're looking for. So just, recognizing that too, that there are could be other limitations to that. First and foremost, someone's healing and improvement in their health outcomes is really linked to their trust in their provider. And then
yes, so many studies are done.
Feeding back that trust and support for them. So again, if you don't feel that's what you're getting, that could also really be a sign that you should look for another specialist.
Yeah, that point, and I'm so glad that you said that, Nicole, because there are so many studies to show, proper good studies that show that if you trust your healthcare provider, your rate of healing, and I'm going to make up a number, I don't know what it was, but it can contribute up to 80% of the therapeutic relationship can be up to 80% of the healing. And so it's not a small number. So your point, if you don't feel trust, or that they're a professional, or that they have your best interests at heart, it will absolutely hamper your ability to get well. And right. I can't state that myself enough. That is, we've got the nocebo and the placebo effect. And the nocebo effect is when a professional, like they said to me, is you'll end up in a wheelchair in 5 years. Or the classic ones with cancer is and they did this great study, you've got 3 months to live. And the study showed that a huge percentage of people, almost 3 months to the day, will die, because that's what the professional said, because they handed all their power over to that person. And then they went back and tested them. And there was this crazy study where a huge percentage of those people didn't even have cancer. And they died because someone told them they would. So that's nocebo. And then that's how powerful that bond is, that relationship. And then on the other side of that, you've got the placebo. If you've got someone that's advocating for you and sort of being your cheerleader and supporting you, how much that contributes to the healing journey. So you reminded me about that. So I'm really glad that you brought that up. So are there any tricks or tips or ways that you can enhance that connection with your healthcare provider to really maximize the healing for you, knowing that how important that role is and what it can play? Is there anything that you would recommend to people?
I would recommend to look for common small goals. And this also kind of ties into the idea of how you can also communicate to your provider if you're seeking alternative treatments. Finding small things that you can both agree on. And I'm talking about basics. So you're diagnosed with this chronic condition. A small goal that you can both agree on is maybe you need to reduce stress. And you're right, that's it. You need to reduce stress. Or you can agree on reducing inflammation as a really just simple example. And then think about, if that's the one small goal, what are some safe treatments that we can start exploring? Or where does our partnership work as we're working on this one small goal, right? Mm-hmm. When it comes to even nutrition, focusing on the benefits of improving the nutritional diet for a client. I think nutrition is, we know nutrition is really the foundation to health and to our body. The other side note really quickly, the other interesting thing about nutrition is most medical providers are not trained in that area, which is shocking. Mm-hmm. So recognizing and part of asking those questions to your provider too, just so that you can understand what their limitations are, but is that another small, simple goal that you both I want to improve my nutrition. And so when you start there, I would say it can help to lower the walls or the guards that sometimes providers may have up, or even the patient may have as they're speaking to their provider. And it becomes kind of a seed that you begin to plant and just build that relationship from that one small seed. And I think what I hear really often is this idea of a resistance from a nephrologist on seeing a dietitian or a nutritionist. But once that patient starts to see improvements, their response is, "You're doing fantastic. Keep doing what you're doing," right? And so as you explore these alternative treatments, if you are seeing improvements, you're seeing the reduction in your stress level and anxiety, you're seeing the reduction in your inflammation, they're going to say, "You're doing great, keep going." So it's just a matter of, I think, breaking it down in a way that's small enough that that provider feels that it's acceptable to start. It gives you the confidence that you're on the right path. And again, kind of plant that seed for a bigger and stronger relationship, hopefully.
Yeah. Yeah, no, that's a really great tip. And I would say 9 times out of 10, yes, providers are amazing at saying, yes, just keep going what you're doing. I had one just yesterday where the patient had massive improvements and the practitioner still said, "Come off all your nutraceuticals and your nutrition and herbs," even though their kidney function is now normal. I nearly fell over. So again, that's all I can think is that's an ego response. Do you have any, if someone does hit that unusual response, is there anything that you would recommend or say there?
I'm going to go back to thinking about that being one piece of your bigger care team, right? So and remembering that anything that you're doing for yourself that's improving your mind, your mood, your stress, your outcomes, small outcomes in your disease progression, that's a win.
Yeah.
And I think it's for you to decide what is a win for you, what is success for you.
Yeah, really, really good point. It doesn't happen very often, but every now and then
That's pretty surprising.
I know. Oh my goodness. Okay, Nicole, is there anything, I mean, I think that's been a brilliant walkthrough, and I think there's so many empowering tools that you've given people, but really to sum up what I heard is the big one is to know that you're worth it. Absolutely. To know that you're worth advocating for yourself. The second one was to empower yourself with knowledge, get really clear on your why and the things that you want to maintain in your life that make you feel good, and working around that. Keeping questions and having those before you go in, and how to interview your practitioner about common small goals, and then keeping all your records and voicing concern as they come up, and going through the channels if you need to, because I think to that point further, if we don't give feedback to healthcare practitioners, no one's going to change. If we've got a fear around them, we're not going to have that. And I know when you've got a chronic disease, sometimes it's really hard to advocate for yourself because you're feeling fatigued and all of those sort of things. But I think to your first point, it comes always back down to the fact that you're worth it, or working with someone like you, or finding another healthcare provider to advocate for you.
Exactly. And I think as you're doing some of this, remembering to give yourself, we're not trying to like warm the ocean, so to speak, right? Yeah. Finding the space when you have an ability to think clearly and understand what's going on, to then decide what your plan of action is, and not to always not to allow the emotion necessarily to be that motivating factor as you're helping to heal yourself and work in a different way to support your body. Yeah.
Always keeping the end goal in mind, huh?
That's right.
Yeah. Well, this has been brilliant, Nicole. And I know I've been asked to do a video on this for ages. So I think people are going to really, really value that. Is there anything else that you wanted to add that we haven't covered that you think is really important in this space?
No, I think we've covered a lot of good points. I think just important for people to know that, you know, groups like yourself and companies like K&I really, like, we really see you, is what I think I want to say. You know, we see you, we understand the challenges and the struggles, and at the end of the day, want to make sure that we are really being the best advocates that we can and supporting, again, from that holistic space.
Yeah, I think that's a really good point. I think that's where we see ourselves as different, because I always see myself as a cheerleader. That's what I say to patients. I don't do any healing. I just give recommendations and then I cheer you on from the sidelines. You're the ones that do all the healing. So no, that's brilliant. Well, I really want to thank you for your time. If you want to know more about Nicole, if you want to connect with her, I'll put her link below. If you head to kidneynutritionalinstitute.org and go into About Us, and I think it's the staff profile, so you'll find her in there and you can click and connect with her. I think when you are diagnosed with a chronic disease, it's one of the things I wish I'd done earlier, was to work with a healthcare practitioner that had, you know, really was advocating for me and empowering me. And again, it's only because I've got my own training that I was able to do that. If you don't, I think it's even more important to have someone like Nicole batting in your side and supporting you that way. I think we forget the emotional trauma and stress of what a chronic disease has, and we just focus on the physical, but having your mental, emotional stuff looked at as well is just as important. If you want to know more about what we do, head to www.kidneycoach.com. You can also find us on Facebook.com/Kidney Coach. Make sure you hit subscribe. That means you'll get notified anytime we do new videos. And we'll definitely have Nicole back. I've sent her and I have talked about a whole pile of topics, and she's got a wealth of information there that I would love to extract from her to be able to share with the community. So Nicole, thanks again. I really appreciate your time, and we look forward to seeing you next time. Thanks for being part of our community. Bye.
Bye.